Then we have status codes. Also a question came in. I had trouble finding a code and was told that it was a status code. What's a status code? Now, you guys, I really like status codes because, of course, that's ICD-9 stuff, that diagnosis that I love so well. You're going to find these in your ICD-9 manuals. And what status codes do is they indicate that a patient has either is the carrier of a disease, or they have a sequela or a residual past a disease or condition. And it's just an informative code that gives you the status that may affect the course of treatment or an outcome. These are going to be V codes. Now, if you want to find these codes, you're going to look them up in your index, in your ICD-9 manual, under status. Here's some examples of some. Now, when I read these off, I'm not going to read the code. I'm just going to go ahead and read what they're for. But you can see those people that are online with us now. You can see them and think about how they would affect the care of that patient. We've got an ankle prosthesis, a colostomy. You see that one a lot. Because think about that. If a patient has a colostomy, again, you've got all kinds of care that revolve around that, not just, we've got diet that's determined and stuff. We've got breast implant removal, bariatric surgery. When that first came out, they wanted people to have an ID badge or a necklace saying that they'd had bariatric surgery for like gastric bypass, because, if they want to go push medications, or sometimes even if they're going to, I'm trying to think of something off the top of my head and I can't, but that, they just need to know if your stomach is been surgically altered, your body absorbs medications and stuff differently because your intestines have been bypassed. So again, giving medication orally can be affected by that. A cardiac pacemaker. I mean, whenever you walk into radiology, what's the first thing they ask you? They ask you, do you have a pacemaker? And if you're a woman, can you be pregnant? What about a ventilator? Again, some people think, well, they see the ICU room and they think to be on a ventilator, you have to be bedbound, but that's not true. There's people that are in wheelchairs that have ventilators, and I saw a picture one time of a girl that was actually taking a college exam that was on a ventilator, and she actually had it carried it, pretty cool. I don't know what her condition was, but for some reason she had to be on a ventilator. Lower limb amputation. This one's huge when you're doing things like auditing and HCC coding. If a part of the limb has been amputated, that is going to affect care, especially if your patient is a diabetic and they've already had a limb amputated. Lower limbs, they're going to want to know. You've got additional digits here that you'll be using to let them know if it's above the knee or below the knee amputation. Again, long-term current drug use. The big one that jumps out here is insulin. If you got a type 1 diabetic, you don't have to use this code because they're going to be on insulin. Now, if it's a type 2 diabetic, however, they could be controlling their blood sugars with diet and exercise. They could be on an oral medication, or they could be using insulin. And then again, there's chemotherapy. I found this little picture of a guy. He's got a below-the-knee amputation here. And, when you see that picture, his care is going to be different than somebody that has both legs. It can even affect your blood pressure, not having to pump through both limbs. Anyway, those are status codes. The best way to make yourself aware of them, go look up status in the index of your ICD-9. Go find these V codes. They start around V43 or 42, and then just read through them, okay? Be aware that they exist. That's the best way to get through them. If you're trying to find a code and you can't, and you think, wait a minute, could this be a status code? And the term to look up is status, and the doctor isn't probably going to use the word status in his documentation.